Kate Johnson. I'm from Portland, Oregon, and I'm 38 years old. I work for Abbott Medical, so I work on their neuromodulation with spinal implants for chronic pain patients. So I actually found a lump by chance because I wear lead for work, and so I usually just rest during cases. I'll rest my hands right here, and I was just like rubbing right here, and I found a lump. It was pea-size, hard, didn't think anything of it, and I was like, I'll just check in my next exam. And then went to my exam, and my doctor actually was like, you're gonna be okay, you're young, this is nothing. And she was leaving the door, and all of a sudden she just was like, we need to get it checked out just in case, because she almost left the room and we're just gonna wait another year. So it was by luck. So went to go get the biopsy. When I was getting the biopsy, the doctor that was doing the biopsy was like, you're gonna be fine. Like nothing in the, because my cancer did not show up in an MRI or any of the images for the mammogram either. So when they did the biopsy, he was literally telling me, he's like, you're gonna be fine, you're young, this doesn't happen to people like I don't see anything that's alarming. So I was like, it calmed me down, and then the next day I get a call saying I have invasive carcinoma. The good thing is, like, Dr. Donovan, she's well known in Portland, she's an awesome doctor, and she had breast cancer during med school, and it really helped like going into the first appointment. So she came in and said, don't listen to anyone else. Every cancer is different. And she was very positive with what we had so far in regards to MRI test, the mammogram. She's like, it's less than 2 centimeters in width, the lump that we found. So she was very outgoing, very positive. And then she was like, we have to do a lumpectomy. And I was like, done. I was very much like, I just want it out of my body. So whatever the fastest way is possible to get it out. So I had the lumpectomy, and unfortunately all the margins were not clear. So we had to go, and so my breast surgeon recommended a double mastectomy. She didn't recommend anything else, but luckily we did a double mastectomy because when we did, I had cancer on the left breast as well. So luckily that, so someone was watching upstairs. And then to do the double mastectomy, to do the follow-up with a reconstruction, she recommended a plastic surgeon. That was phenomenal, met him, and he did my reconstruction. So after the double mastectomy, they placed tissue expanders. So I wore those for 3 months, and then I had my final implants put in November. For breast reconstruction, that was just a natural step. I never thought of not doing it. I just knew I was going to do it. So when my plastic surgeon recommended breast implants, he gave me a couple different options, and I just really trusted his judgment. I knew he's just like, when I go into the room, and size-wise, we didn't know. He's like, I go in with 3 options and I pick for you. The biggest thing for me is I trusted him. He chose the smooth, high-profile Natrelle breast implant, and I'm very happy with the result. I think words of encouragement, I would just say, you know, every day is a new challenge, and just be strong and you can get through it. And I think making, you know, just making light, not of it, but just making light, like there's going to be an end, and just taking the support you need. My main goal in sharing my cancer story is it can happen to anyone. It doesn't matter age, and technically my cancer, the average age is 60, so just hearing the words cancer it's not a death sentence, so you can get through it.
Natrelle Breast Implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher: autoimmune diseases, example lupus and scleroderma; a weakened immune system, example taking medications to decrease the body's immune response; planned chemotherapy or radiation therapy following breast implant placement; conditions or medications that interfere with wound healing and blood clotting; reduced blood supply to breast tissue; clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.